class. My name is Lisbeth, and our group is going to do our presentation on syncope. So our people are Christine and me, and we are hygienists. And we have Guillermo playing Gima, which is an elderly lady. And so for syncope, there are three distinct categories, which is cardiac syncope, non-cardiac syncope, and neurocardiac syncope. And I hope that our play demonstrates the treatment, the symptoms, so whenever it does happen, well, hopefully it doesn't happen, but if it ever occurs, you guys are prepared to take action, okay?
Some of the signs and symptoms that you may experience whenever you see syncope are as follows. Well, for the pre-syncope, it's the patient gets paler or their pupils start to dilate. They have weakness, they have dizziness, they have vertigo, they have nausea, yawning, visual changes, so they can get like blurred vision. Blood pressure is elevated, and then their pulse rate is elevated, and they have a shortness of breath and heart palpitations and chest pain. And then whenever they're actually experiencing syncope, they become a lot paler, and then they also become unconscious, and they become weak, and then they have a slow pulse.
Alright guys, I'm going to teach you the treatment of syncope. When a pre-syncopal or syncopal symptoms are recognized, all dental procedures should be suspended and all objects should be removed from the oral cavity. Pre-syncopal symptoms indicate a 50 to 70% decrease in blood flow to the brain. If consciousness is lost, the patient should be placed in a supine position with the patient's legs slightly elevated to facilitate the blood return when they lifted up my legs. Additional procedures should include opening the airway and accessing circulation. Tight clothing should be loosened, such as ties or belts that can decrease blood flow to the brain. Oxygen should be administered at 4 to 5 liters per minute. If unconsciousness persists, emergency help should be summoned. A syncopal episode can last anywhere from a few seconds to several minutes. Vital signs should be monitored during the entire episode. If bradycardia continues, 0.6 milligrams of atropine IM can be administered to block vagal stimulation and increase the heart rate. The longer the patient remains in the syncopal episode, the more likely it is that he or she experience a seizure due to lack of cerebral oxygenation. If this occurs, the seizure would need to be treated, as well as the syncopal event. Emergency medical services would need to be contacted immediately and the patient transported to the emergency department. Following the syncopal episode, patients should remain in a supine position until they feel well enough to be returned to a seated position and their pulse returns to a normal baseline reading. Patients should be repositioned slowly to avoid inducing a syncope recurrence. An attempt should be made to determine the cause of the syncopal episode to avoid future episodes. All dental treatment should be suspended for the day, and arrangements should be made to have an emergency contact escort the patient home because syncope can reoccur. Reoccurrence of another syncopal episode is a higher risk level for the first 24 hours following the event. Anti-anxiety medications may be advised at future appointments. 3.
Syncope is defined as a sudden, transient loss of consciousness in postural tone with spontaneous recovery, most often caused by loss of cerebral oxygenation and perfusion. This lack of cerebral oxygenation is also referred to as cerebral ischemia. I can't do it. Am I pronouncing it right?
Yes.
Do I keep going?
Yeah, just keep going.
Okay. Syncope is a sign rather than a primary disease process and ranges from benign disorder to a life-threatening situation with potential for mortality. Many times, it is a sign of another underlying medical condition. Syncope is often associated with a stressful situation, such as a dental appointment, and specifically the administration of local anesthetics.
Syncope is the most common dental emergency. It affects individuals of all ages. However, children, pregnant women, and elderly are especially susceptible. In the elderly, syncope is often associated with postural changes, defecation, coughing, orthostatic hypotension, and medication. Other diseases or conditions from which the elderly commonly suffer, such as coronary heart disease, heart failure, diabetes mellitus, renal insufficiency, chronic obstruction, pulmonary disease, can also lead to syncope episodes. Most emergency in the dental offices occur during the administration of local anesthetics.
Hello, Gima. How
Oh,
are you doing today?
I'm good. How are you doing?
Good. Let's take you by here so we can take a look at you, okay?
Hey, can you hold my purse, please, honey? I can't carry no more.
So let's have you sit down. No, over here, honey. Okay. How are you feeling today?
I'm feeling wonderful.
Are you?
Yes. I was so tired. I put my sunglasses and my hat. Oh, can you please pass me my purse, please?
Of course.
I can't reach it. Oh, thanks, honey. Oh gosh.
What are you looking for?
Medication. I just can't find it in this purse. This is so big. Oh.
Hi, Gima. I'm Christine. I'm
Oh,
your
hey.
dental hygienist.
What's your name?
Christine.
Okay.
There you go. That's
You're
your
so
chart.
cute. I just can't see you. Oh.
Thank you. Okay, so I'm going to ask you a few questions really quick.
Okay.
What brought you in today?
Huh?
What brought you in today?
I'm getting a cleaning, I think.
Okay. All right. And let's see. So you're in good health?
Yes,
Are you
ma'am.
under a care of a physician?
Yes, ma'am. I believe so.
All right. So I'm going to check your vital signs, okay?
Okay.
All right.
Would you like me to
This is
take
gonna-
off my scarf?
If you don't mind.
I'm sorry, I have big muscles.
You've been working out, Gima?
Yes, ma'am.
That's good to hear. All right. So we're just going to...
Wait.
Here we go. So we're checking your vital signs. All right. You might feel a little bit of a slight pressure on your arm. Oh my gosh.
What?
Gima, you look like you're experiencing some high blood pressure. Do you know what your blood pressure usually is?
I have no idea.
You have no idea?
I have high blood pressure. Oh no.
It's okay. It's probably because of your anxiety. Are you feeling okay being here today?
I'm feeling perfectly fine. A
Okay.
little bit.
Yeah, because we did schedule an early appointment. Because last time, remember, you felt a little bit anxiety.
Yes.
So we said we're gonna sign you up for a little earlier appointment.
Okay.
No, we're just gonna clean your teeth, make sure everything's okay, and it's all for your health, okay?
All right. Thank you.
Okay.
I'm getting kind of cold.
You know, it gets chilly in here.
All right, Elizabeth, would you mind sitting him down? Of course.
Whee!
Okay, that's good.
Come on, you want to have to fix your dress first.
Okay, so we're just gonna take a look in your mouth, okay? Oh, you're starting to look a little pale, Gino.
Oh. I don't know what's happening. I'm feeling kind of weak.
Oh, Elizabeth, sit him up, please.
Oh.
Very slowly.
Oh. You're going the wrong way. Oh.
You'll be okay. Hold on,
Honey.
we're gonna check you out.
Honey, I'm getting so dizzy right now. I'm getting so dizzy. I'm getting so dizzy.
Are you gonna be okay?
I'm so tired too.
Elizabeth, his pupils are hurt. His pupils are dilating.
Honey, my chest is hurting so bad right now. I feel so weak. Honey. Oh. Oh. Should I pass out? Oh. 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 Yes.
Are you feeling better?
No. Yes, a little bit. Just a little bit. It's kind of
Okay, so
weird.
just so you know,
I think you'll be okay.
if just so
Okay.
you know, if you do start feeling like that again, we do have oxygen, so we can apply it to you. Okay?
Okay.
Are you feeling better? Can we continue treatment?
I'm okay, honey.
Okay.
I'll be
You'll
fine.
be okay.
Okay.
Are you feeling
I
alright
was
now?
just a little bit scared, but I think I'll be fine.
Okay, that's why we rescheduled you
Thank you. I
in
was just
an
a little
early
bit
appointment,
nervous.
okay?
Okay, thank you.
Okay. Alright, so we're gonna administer some local anesthetics.
Are you serious? Oh.
Elizabeth, put him in supine position. And elevate his feet. Her feet. Okay, I'm gonna monitor his vitals.
You guys suck at this.
Keep going. Okay, I'm gonna monitor her vitals. And if bradycardia continues, I'm gonna give him 0.6 milligrams of atropine, IM.
Hey guys, I'm Jima. And so, I'm gonna fix my stuff first. Shoot. Alright, so today we're gonna learn. I kind of passed out, I know, but it's all good. So there are various forms of syncope, and they're generally classified into one or three distinct categories: cardiac, non-cardiac, and neurocardiac syncope. Cardiac syncope results from inadequate cardiac output and usually occurs as a result of serious underlying heart disease. I was dying. Hope you guys understand that. They're usually from underlying heart disease, commonly from arrhythmias, tachycardia, bradycardia, and pacemaker malfunction. It can obstruct the left ventricular, which is the most common. This type of syncope can be potentially fatal. A referral to a medical profession is required.
Non-cardiac syncope has a wide scope and includes, but is not limited to, such entities of syncope from seizures, orthostatic hypotension, situational occurrences, hyperventilation, and metabolic diseases. Seizures can happen during any type of syncope episode because of reduction of cerebral oxygenation. Seizures are due to reduction of oxygen to the brain. Orthostatic hypotension, reduction in blood pressure when assuming an upright position. Valsalva's maneuver forced expiratory effort against a closed airway. Hyperventilation, which is excessive breathing causing change in chemical made up of blood. Can cause sufficient cerebral vasoconstriction, which can lead to syncope.
Neurocardiac syncope is the most common type of syncope. It's known by various identifiers: neurocardiac syncope, vasopressor syncope, vasovagal syncope, neurocardiac syncope, or natural medicated. Activation of the autonomic nervous system, which is our fight or flight response. The release of catecholamines, epinephrine, and neuroepinephrine into the circulatory system, which increases blood, particularly to periapical skeletal muscle, in preparation for movement. If no movement occurs, such as in a dental office, the blood pools in the extremities, causing hypotensive response, bradycardia, and decrease in cerebral flow, leading to syncope.
Well, guys, hope you liked our presentation. My name is Elizabeth.
This is Gma.
And Christine.
Later.
And that's syncope.